I'm Charlie Hennekens. I have an MD from Cornell, a doctorate of public health from the Harvard School of Public Health, and an FACC. I was the first Eugene Brownwell Professor of Medicine at Harvard Med School. I'm currently the first Sir Richard Dahl Professor and Senior Academic Advisor to the Dean of the Charles E. Schmidt College of Medicine at Florida Atlantic University in Boca Raton, Florida. I have presented an invited address on statins and the treatment and prevention of cardiovascular disease, as well as another on aspirin in the primary prevention of cardiovascular disease. And one of the outstanding features of this meeting that coincides well with my research is the emphasis on therapeutic lifestyle changes as the major way to reduce premature morbidity and mortality from cardiovascular disease, and then the drugs of life-saving benefits such as statins, aspirin, ACE inhibitors, beta blockers should be used as adjuncts, not alternatives to these therapeutic lifestyle changes. And I believe this meeting focuses both on prevention and treatment, on the therapeutic lifestyle changes as well as the adjunctive drug therapies, and therefore really provides a valuable public service to clinicians and improves the health of the general public. With respect to the statins, statins should be used as an adjunct to therapeutic lifestyle changes, and the totality of evidence today indicates that we need much wider utilization, not only in the treatment of survivors of acute coronary syndrome, but of long-term survivors of all occlusive vascular events. And in addition, in primary prevention now, the bar has been set because the data indicate that there's no threshold of LDL below which we don't see a therapeutic benefit of statin administration. I do believe that guidelines are based on the randomized evidence, but they should provide guidance to the clinician and not rules for the clinician. Each of the clinicians should make the best judgment for his or her patients. Finally, with regard to aspirin in primary prevention, this should be an individual clinical judgment of the individual clinician based on all the risks of clotting against all the risks of bleeding, and should be an adjunct, not an alternative to therapeutic lifestyle changes.